Did you just have a sexual intercourse and there wasn't the use of protection and you're really worried on what to do next? Worry no more, because this video will be explaining that. Hello, I'm Dr. Ayuk. I'm a medical doctor and I do videos on health education. So in this video, we'll be looking at what next to do after having unprotected sex. We'll begin by defining what unprotected sex is all about. Unprotected sexual intercourse simply means sexual intercourse without the use of barrier, which is condoms, or there was an actual use of barrier, but within the process, an accident occurred and it resulted in the leakage of fluid of semen into the female reproductive tract. Or it could be as a result of you taking your birth control pills but you forgot to take and you had a sexual intercourse that was not protected. So what are you to do after these occurrences? Before we look at what we are actually to do as ladies, we should first of all look at what can happen if we do nothing. The first thing is, I think everyone knows, pregnancy. And the second aspect is sexually transmitted infections. So with pregnancy, I've done a video on how to know your length of your menstrual cycle and how to know your fertile days or your date of ovulation. If you've not watched that video, I recommend you do watch it first before diving into this. Okay, so pregnancy can occur at any time in the menstrual cycle, but the chances of it occurring are either low or high depending at what stage you are in the cycle. So if you are higher risk or your fertile window, then the probability of becoming pregnant is so high. But if you're on your relatively safe days, then the chance of you becoming pregnant is very low. So, are you worried about pregnancy after having an unprotected sexual intercourse? We actually have 3 options that are available for you. We have 2 pills and the use of a device which is inserted into the womb. Now, whatever method you decide to go about depends on your own personal preference and also on the number of days after the incident occurred. This takes us to the first option, which is the first pill I'll be talking about. It's called Ovanel, but in the name differ from different countries. Like in my country, it's called Postinor. It's very common. Most girls in their most girls who are sexually active must have heard or used this pill at one point in time in their life. So this pill, normally it works by stopping or delaying ovulation from occurring. Ovulation simply means the time in which your egg is being released into the fallopian tube, from your ovaries to the fallopian tube. So that is ovulation. So if you are not yet ovulated during that cycle, this pill is going to prevent that from happening or delay it from happening. Mind you, if you have already ovulated, then this pill really doesn't help. I'm sorry. So you take this pill immediately after this or as soon as you can get it, but it has the 3 days window where you can take it. If you vomit after taking this pill within 2 hours, it's good to take another one. And what you should watch out for is if there is any delay. It can cause delay in your period, but if you have any delay of more than 3 days, then you should do a pregnancy test. Or if you have your period but it comes so scanty and so scarce, which is different from your normal periods, then I'll advise you do a pregnancy test for this. With this being said, we'll move on to the next pill, which is called Elawan pill. This pill is very similar to the first pill we just talked about, but the difference is that this pill can help to prevent pregnancy for up to 5 days. With the first one, it was just a 3 days window, but this can actually go right up to 5 days. So if 5 days after having an unprotected sexual intercourse and you are afraid of pregnancy, then you can actually get this pill. So same as the first pill, you take it. If you vomit within 3 hours of taking this, then retake another one. Also to check out if your period becomes so delayed, do a pregnancy test. And also to, if your menses is kind of scarce, then you should, or very slight, then you should do a pregnancy test as well. Now we move on to the third option, which is the copper device. It's called intrauterine copper device. This is the most effective form of emergency contraception. Why I say this is because this actually, even ovulation has occurred, this acts in such a way that it prevents, first of all, it produces the copper, it kind of reacts with the sperm cells and destroys them. Or if pregnancy has already occurred, it prevents that pregnancy from implanting into the womb. So it is the most effective, and it can be used within 5 days of that occurring. This is being inserted into the womb, and it is very effective. But there are some things in which if you have as a lady, then this option would not be given to you. One of it is if you have an active infection in your private area, such as you have a sexually transmitted infection, or if you're pregnant. If you're pregnant, we can't really give you that. So those are the 3 options that are available. So you can choose whichever and whatever is suitable for you. Also too, these pills that we mentioned can be taken more than once in a cycle, and if you take it today, it just works for the previous sexual intercourse, unprotected sexual intercourse you had. You can't like say, oh, I've taken it today, then I can have unprotected sex at night. It won't work for that one. So you take it for the previous and not for another episode to happen. Another thing about the copper device is also too, you can insert it and then you just leave it there as your method of contraception if you want. Now we'll move on to sexually transmitted infections, which is also something that can happen after you have an unprotected sexual intercourse. Now there are different kinds of sexually transmitted infections that can occur. Some can respond to antibiotics, but there are some in which actually there is no cure, like HIV, but there are things that you can do to prevent them if you've already had a sexual unprotected sexual intercourse. So sexually transmitted infections such as chlamydia, gonorrhea, trichomoniasis, those ones, regular antibiotics can help with that. So we generally advise that if after unprotected sexual intercourse, although this is not evidence-based, but if wean immediately after that, it can help to flush out some bacteria from the reproductive tract, right, that can prevent you from having urinary tract infections or some sexually transmitted infections, but that has not been studied. It's good after that you just have a wash and then you can have a wee. That will help a bit. But if you come down with vaginal itches, burning while passing out urine, or offensive vaginal discharge, or a change in the color of your vaginal secretions, then you should see a doctor for that. Okay, other sexually transmitted infections that you can have also, we have hepatitis B and C, and we have HIV as well. If you're worried about HIV, then you don't really know about the sexual health of your partner, there is something called post-exposure prophylaxis, which can be given within 3 days of you having that unprotected sexual intercourse, which is going to help in preventing you from getting HIV, which is HIV that we know. So within 3 days window, you can actually have that. You just need to speak to your doctor and have that sorted out. But infections such as hepatitis B and C, which can be gotten not just from vaginal intercourse, whether anal intercourse or oral intercourse, you can still have that. It's just for you to watch out for the signs for that and get to your healthcare practitioner. I'll be doing videos on sexually transmitted infections, so I'll not go in depth with that. So I'll always advise practice safe sex and be good. So if you found this video helpful, why not give us a thumbs up, subscribe to our channel, and if you want any health topic that you want me to do a video on, just write it in the comment section and I'll be doing that for you. Thank you so much for watching, and be good and stay healthy. Bye.